Do you feel like you are constantly carrying a heavy load in your pelvis? Or heavy period got you down? Well, come find out how fibroids could be the culprit behind your excessive bleeding. Hi, I'm Soso, and on today's video, I am going to be talking on uterine fibroids. So stay tuned and don't go anywhere. Uterine fibroids. Uterine fibroids are non-cancerous growths that develop in or around the uterus. They are made up of muscles and fibrous tissue and may vary in size, shape, and location. Now, according to the Office on Women's Health, about 20 to 80% of women will develop fibroid at 50 years. However, some may not have any symptoms and will never know or may never know that they have fibroid. Quickly, we'll be going over to the types of fibroids. There are several types, but for the purpose of this video, I will be talking on just three. The first one on my list is intramural fibroids. Intramural fibroids are one of the most common types of fibroids. They grow within the muscular wall of the uterus. They can grow larger and stretch the uterus. The number two on my list is subserosal fibroids. Subserosal fibroids are the ones that grow outside of the uterus. They grow outside. Remember, the first one was they grow within the muscular wall, but this one they go outside of the uterus. And these ones they can grow large enough to make the uterus appear big on one side. You get me? They can make the uterus appear big on one side. So the third on my list is cervical fibroids. Cervical fibroids, these are the ones that develop on the cervix. And what is the cervix? The cervix is the one that connects the uterus to the vagina. Note, this particular one, this cervical fibroid, it's rare. It's not something that is common, it is rare. So next we're going over to causes and risk factors of fibroids. It is unclear why fibroids develop, but with a couple of different factors that may influence their growth. I have number one on my list is family history. Now, note that if this condition runs in your family, maybe your mother, your grandmother, your sister has this condition, there's a probability that you also will develop it. That is just how it works. Then number two is hormonal influence. Estrogen and progesterone tend to stimulate the growth of fibroids. I don't know if you understand. Then number three is age. Fibroid is common mostly at reproductive years, which is at childbearing age. I hope you understand that. Then the last one on my list for this video is obesity. Obesity tends to increase the risk of one developing fibroids. Those are just the four causes and risk factors I will be listing for this video. So quickly, I want us to go to the symptoms of fibroids. The number one symptom on my list today is heavy bleeding between or during periods. That is, one in the process may tend to even experience menstrual clots or menstruation that lasts longer than usual. Number two is infertility and recurrent miscarriage. Fibroids can interfere with implantation, growth, or even the maintenance of pregnancy. The number three is increased menstrual cramping. Number four, we have pain during intercourse. Number five is swelling or enlargement of the abdomen. This is the part where one tends to look pregnant but they are not pregnant. Number 6 is the pressure of fullness in the abdomen. One tends to feel full in the abdomen. Number 7 is pain in the pelvis or the lower back. Number 8, which is the last for this video, is frequent urination. As the fibroid presses on the bladder, one tends to urinate frequently. So that is all for the symptoms of fibroids. Quickly, let's run through the treatment options. I have just two on my list, but the number one is medication. Under medication, we have hormonal therapies. Now, how does hormonal therapies help fibroids? Hormonal therapies help fibroids by targeting those hormones that fuel the growth of fibroids. By targeting those hormones that fuel the growth of fibroids. Aside hormonal therapies, we also have pain relief. It's also called prescribe pain relief to you, and also iron supplements. Then the number two, we just finished with medication. We're going over to the number two treatment option, which is surgery. Yes, we can surgically remove the fibroids. Surgery like myomectomy. Myomectomy is the surgical removal of fibroids. We also have hysterectomy, which is the surgical removal of the uterus. So these two treatment options, your doctor will be the one that will determine the one that is best fit for you. So we have come to the end of today's video. I want to say a big thank you to everybody that stayed to the end. And before I go, I want to drop this with you. If you suspect that you have fibroids, do not hesitate to consult your healthcare provider. Remember, knowledge is power, and taking charge of your health is the first step to healing. I'll see you on my next video, but before we go, do not forget to like, subscribe, and share this video. I'll see you on my next video. Bye.